Everybody, thank you for those who are joining us here right on time, right on schedule. It is up with joining us today. You've got myself as well as my colleague Anne Marie, and let me actually just make sure that my screen share is going through here as well. It looks like it disappeared on me for some reason. There we go. All right, that's what we wanted. All right, so I'm sure we have a bunch of people that are just starting to get in. Thank you all for joining. Those of you who are in here early or on time, we really appreciate you joining us for the session today. This is actually officially our most registered webinar of all time. It was probably like 6 years ago. 6 years ago was when I first started doing these webinars here at Compliancy Group. And I think the first couple of webinars I did, we had, I don't know, maybe 20 or 30 people that signed up. And today we have well over 1,000 people that registered for this session. So again, we really appreciate everybody joining. We hope that you get a lot out of this content today. A few housekeeping items just to give a very general agenda for the session today. General welcome introduction, that's what I'm doing now. Okay, so a few housekeeping items. We get lots and lots of questions about like if the slides will be sent or if you'll be able to have access to the recording, things like that. Absolutely, you will have access to the recording. That will be sent out immediately after the webinar. Usually just give it like 24 hours for you to get access to the recording. Okay. There is as well on the right-hand side, you'll see the option to send chats. You have the ability to access the Q&A feature as well. I would encourage you, if you have questions, please send it directly into that Q&A feature. As we're going through the topics today, the goal is we want you to get out of this kind of what you're hoping to get out of it. So if there's something that you'd like us to be a little bit clearer on or that you'd like us to unpack further, or just a general question maybe that you even have right now as you're coming into this, feel free to go ahead and send that into the Q&A. We'll be circling back and doing some question and answer at the end. Today, we're going to be talking about risk assessment, general risk management, from like initially identifying areas of risk all the way through to risk assessment and then long-term monitoring of risk. And we'll be giving some very practical application tips as well. I do want to introduce everybody to my colleague, Anne Marie. Anne Marie is the real expert here as far as compliance is concerned. I have learned a lot from her in the time that she has been at Compliancy Group. And I think she has just a super valuable background. And so the goal for today is to kind of have some open dialogue and be able to hear and learn from her. Anne Marie, I don't know if you wanted to maybe share a little bit of like your background, how long you've been with Compliancy Group, some of that before we get off the ground here. Yeah.
Sure. Hi, everyone. Thanks for taking time out of your day to come talk to us about risk management. I am an attorney and also a former compliance officer, director, and consultant. I have over 30 years experience in healthcare compliance and regulatory matters, and I'm happy to be here today.
Awesome. Awesome. And Anne Marie, can you remind me, how long have you been with Compliancy Group now?
Almost 4 years.
Almost 4 years. Okay. Yeah. So, like I said, everybody, Anne Marie is somebody that I have personally learned a ton from in the time that she's been here. I think it's just a great opportunity to ask questions from somebody that truly is an expert, has done the job of a compliance officer, and has a lot of history, a lot of background here. So, I think we're in for a good session today. Before we launch into the actual content of the webinar, we wanted to start out today by doing some quick polls with everybody. And one of them is we sent out some surveys prior to the webinar, but we have a lot of people register after we did those surveys. So I want to quickly, you'll see coming up on your screen a poll just asking about your level of familiarity when it comes to conducting risk assessment. We want to know, like, is this something that you are super comfortable with? You've been doing this for a very long time. Maybe you've never done a risk assessment before, or you've never engaged in this type of a process in the past and you're looking to learn. Or maybe like you're somewhat familiar, sort of in between, and are looking for strategies to just maybe enhance something that you've already done in the past. We have a lot of votes coming in now, so everybody should be able to see that on the screen. And it looks like we have a subset of our audience today who is very familiar. You do them regularly. Thank you all for joining, those of you who have a lot of experience in this arena. Our hope is that, especially for those of you who are sort of in that somewhat familiar to not familiar zone, we want to give you a good foundation here today to be able to build off of. But then we also hope to give some more advanced strategies for those of you that are actively engaged in these areas. So I think for everybody that's in here today, you'll have good things that you can learn. I'm going to go ahead and close the poll and take this down. The other question that we always like to ask is more so regarding the size of your organization. And also whether or not compliance is your main responsibility. So, because I think depending on the size and the scope of your company, it can have different levels of impact as far as your practical needs, as far as risk assessment are concerned. So, if you could just respond to this poll so we can get a general gauge on the size of the companies that we have attending the session today, that would be super helpful. And it looks like we have a bunch of replies coming in here now. Okay. And we've got about 250 votes that have come in so far. And it looks like the majority of the audience today is sitting somewhere in that realm of like 5 to 500 employees, give or take. Over 50% of you are in that 5 to 100 or 100 to 500 range. And then 26% 500 plus. That's really helpful for us to know, just to get a general idea as far as the size of organizations that we have listening in. It also kind of impacts the complexity of your environment and what your risk management needs might be. So thank you all. I'm going to go ahead and close this one out now. And then last question is going to be, is compliance your main responsibility within your company? Or is this like one hat of many, right? So there are probably many of you on here where you have a completely different job. You wear 10 different hats, and compliance is kind of like the area of responsibility that's just kind of been like paper clipped on to a very long list of many, many other things. If that's you, we also kind of want to know that, because if this is not your main area of responsibility, it's not your main area of focus, that also has some impact. And it looks like we have a good mix of folks here. So, uh, interesting that from 267 votes so far, now almost 300 votes, the majority of you are wearing multiple hats. Be curious, even if you wanted to send it into the chat, like what is your main area of responsibility and how that overlaps into compliance? Feel free to send that into the chat if you want to. I'm going to go ahead and take this poll down now. We really appreciate all of the insight. I think it just kind of helps Anne-Marie and I make sure that this content today is going to be relevant for you. So looks like we have some people actually in quality and HR, collections, IT, office manager. I'm seeing IT security, cybersecurity, health information manager, contracting. So lots of different roles that we have on today. Again, our goal is like for those of you that are involved in compliance, but maybe it's not the main job responsibility that you have, we hope to give you some ideas for how you can make this a simpler aspect of your responsibilities, right? With that said, I'm going to start us out here just by giving everybody a brief little bit of background on Compliancy Group. And I think for those of you, we have probably many existing Compliancy Group customers on this webinar. I think we had at least a couple of hundred existing customers register. The rest of you might not know anything about us. So what I'll begin by saying is that Compliancy Group exclusively works with healthcare organizations, right? So both healthcare provider organizations, as well as healthcare vendors and business associates. We work with over 4,000 organizations throughout the country, and actually in multiple countries where there could be international involvement. We've been in business for about 20 years. You could check out our online reviews, see what other people have to say about us. In terms of our customers, we have something that we call our audit response program, and no existing Compliance Group customer that was audited that leveraged our audit response program has ever been fined. It's for that reason, not only like the user friendliness of our system, but also the effectiveness of our system We are the #1 rated healthcare compliance software on review sites like G2. We are also endorsed or preferred by over 40 different healthcare associations. And I'm not saying this for the sake of like just giving us a pat on the back here, okay? I'm saying this because hopefully the tips and the principles that we'll be talking through today are things that have been proven to work and be effective over a very long time. And our goal is to hopefully share some of that wisdom with you as we go through the session. And so, with that in mind, we're going to open this up by talking about just like why risk assessment and specifically like a risk management strategy is so crucial. And beginning this topic of conversation, one of the reasons I think this is important is because of how broad healthcare compliance can be. So, this is a mind map that we created using an AI tool that highlights all of the different areas that could be important for you to be looking at within the context of a healthcare compliance program. And you'll see it's super broad, very expansive, going from areas like HIPAA, privacy, security, to OSHA, to MIPS requirements, fraud, waste, and abuse, billing and finance. There's a lot here. And risk management, and as part of like a compliance strategy, I think can sometimes be so broad. I wanted to open this up today by talking like in just to getting some of insight from you, Anne Marie, as far as somebody's on this webinar and they have so many different areas of compliance that they could theoretically be looking at or theoretically starting at. In your experience, what is like your recommendation as far as where to begin? Like, what are like the most bang for your buck types of things that people should be focusing on?
Honestly, I think the most important thing is to focus on the organization that you're in, right? You have to focus on what's important to not only the patients or customers that you have, but the executive team and the strategic plan. Where are you going? Where have you been? What are you doing well? And what are you not doing well? And you have to measure that first in order to determine where I need to go first. Where do I have my highest risks? And also, where do I have wins that I want to, make sure everybody knows about, right? You don't want everyone to think that you're always looking for the bad things. You also want to find the good things and amplify them and congratulate people for continuing to do work that is meaningful and brings the organization into compliance. So that's what I would say. It really is dependent
It's going to vary.
on knowing your organization. Yeah.
Do you, in your experience, does that usually become clear quickly? Like you're getting into a new role, let's say in a new organization, is it usually pretty clear like where the strengths and weaknesses are generally?
It's always interesting to me when I do onboarding, when I have a new role, I usually ask for onboarding if they don't have it, and I wanna talk to lots of different people at lots of different levels of the organization, and I always ask them, "What are your top 5 concerns? What are your top 5 things you're doing
Mm,
well?" And it's a really great way to start a conversation. It's also a great way to make a connection and to
yeah,
see, how different people at the lower ends of the organization feel about things than people at the higher ends of the organization.
yeah,
So don't forget to, ask everybody, right? Ask anybody you're sitting at lunch with or whatever. It's a really great way to start a conversation. And it's also a nice way to say, I'm not coming in knowing everything. I want to know, what you know. Share your knowledge with me. Um,
yeah. Now that's good insight. I've spoken with compliance officers that had been doing the role for or had been with that organization for 30 years. Maybe not in compliance, maybe they started somewhere else, but those are the people that I think usually have like their finger on the pulse on like what needs to change just because they've been involved in the culture for so long.
yes.
Um, I think it's good insight. Like if you're coming into this new, just talk to people. Like you probably have somebody in the company that's been there for 15, 20 years, and they would probably give you like this is the bad thing right now. Like, this is what we need to fix. And so that could give some that's an interesting insight. Yeah, that's good.
Right. I
I like
mean,
that.
and you also need to look outside of the organization, right? What are the current enforcement? What are the guidances that are coming out? What new law or regulation do you need to be in compliance with? What new technologies are you implementing in your organization? And try to get in at the earliest level of decision making, so that compliance doesn't become a roadblock at the end, right? It should be a strategic part of addressing and finding risk early on in a process.
Yeah. No, makes a lot of sense. I think we talk a lot here about the seven elements, and for those who are more experienced in compliance, the seven elements is extremely familiar. We are, of course, today focusing more specifically on risk assessment, auditing, and monitoring. One of the things I wanted to ask you, like the seven elements, can sometimes give the idea of like a step one, step two, step three, step four type of a feeling. Where do you where do you think risk assessment, auditing, and monitoring actually falls in to like the list of things that a compliance officer should be doing? Like, what is it number five, or should it actually fall somewhere else in the spectrum?
Well, I actually don't look at this as a step by step. It's really a lot of these happen at the same time, right? And a lot of them
Yeah,
are pieces and parts of putting safeguards in place for risks that you already know about. If you look at this in the seven elements of an effective compliance program, so this is the OIG view, really, the HHS view of seven elements. But if you look at the Department of Justice, they add an eighth element. And the first thing that they expect you to do is to do a very high level risk assessment, right? One that's not um, focused on a regulatory issue or a particular industry requirement. It's focused on the organization as a whole, what I like to call an enterprise risk assessment. And it's just
yeah,
like super high level, 10,000-foot look at the organization. And the Department of Justice then expects you to basically build your compliance plan based on the risks that you measure in that broad look. Um,
yeah,
I think to me, and then you also have the risk assessment, auditing, and monitoring on very specific requirements, right? And needing to bring evidence together and do all of those things. So I think if you look at it kind of risk in those two levels, right? You do the highest list first, and then you know where to put your resources based on that risk.
hmm,
Um, and then you utilize the seven elements here to do that on a project basis for each of the things that you're trying to address.
yeah. In the past for you, what did that look like practically? Like you're doing more of an enterprise-wide assessment, let's say, very, very high level. What are you looking at to kind of make those decisions as far as like what are the high areas of risk?
Honestly, the highest areas of risk are usually determined by people within the organization. So
Yeah,
for me, we would put together a committee and we would do 3 or 4 workshops, hour and a half workshops. As a matter of fact, we just really did it here at Compliancy Group.
yeah,
Um, and you just bring together executive thinkers and other thinkers, other groups of people, and you ask them and you talk to them and what the risks are, and you it's really fun to do it if you, like, use Post-its on a whiteboard or whatever. People really understand that, there's a lot of agreement on what the highest risks are, and some of them are hidden risks, right? Like
yeah,
people risks, and some of them are known risks, like cybersecurity risk, right? That one's always almost one of the highest ranking no matter where you look, simply because everything changes so quickly, and no matter how many safeguards you put in place, you're still gonna have some inherent risk left at those
yeah.
levels.
I speak with a lot of folks where the sentiment is almost, and this applies to both very small organizations as well as very large, where the sentiment of the person responsible for compliance, person or persons, is I care about this, but I'm having like a hard time getting other people to care about it. If in your mind, like what happens when the executives maybe are not very conscientious about areas of compliance, like where do you go then typically?
Well, I think you have to be a participant in that risk assessment so that your voice is being heard there. And then you
Yeah,
have to be able to back up why it's important. Talk about the enforcement of whatever it is that you're talking about, talking about how much it's in the news, how much the directors of your organization, if you have them, are going to care about it.
yeah,
How much your patients are going to care about it because they've been hearing about it and they want to know what you're doing. And you want to be able to have your staff have an answer to that question
yeah.
if it's
No,
given.
that's very helpful. And I was looking even through one of the questions that we had come in. One of in the industry right now, I think there are some things going on that seem to be particular areas of concern. We actually had a question from somebody mentioning that they are particularly concerned right now about the proposed rule updates for covered entities that would make certain security items required. I actually wanted to start by, like, before we go into some of the other topics as far as risk assessment, I I knew going into this that that was going to be one of the things that people wanted to discuss in this session. So I'm going to quickly give a little bit of an overview as far as that's concerned, and then we'll dig a little bit deeper into some of the practical components of risk assessment and risk management. But for everybody listening, like one of the things that Anne Marie was mentioning was like not only paying attention to what's happening in your organization, but then what's happening in the broader healthcare landscape as well. One of the interesting things that is happening right now in the broader healthcare landscape is that objectively, as far as areas like cybersecurity, healthcare has never been doing worse. Okay. And you look at this chart, this is showing the spectrum of breaches that have occurred from 2029 through to 2024. And you'll see, even in just the last couple of years, from 2022 to 2024, there's been a 300% increase in individual records breached. And that, in many ways, directly correlates to the second chart that I could show you here, which is cloud solution adoption in the healthcare industry, where back when the original HIPAA security was written, it was close to like 0 to 5% cloud adoption by healthcare organizations, right? You would have had to have maybe a physical file cabinet stolen to have a significant breach of like paper records, or maybe it was on a localized server. Nowadays, you could have one vendor that has a breach, and that vendor could be potentially be compromising millions and millions of patient records. So I think that like that.
If you don't
Go ahead.
mind, it's
Oh,
interesting you
please.
say that because, that's exactly what happened this year, right? The Change Healthcare almost
Yeah.
doubled the number of breaches that happened in 1 year simply because they had access to so many records from so many different provider organizations.
Yeah, and it seems like what's happening now for especially for our audience is the government is starting to respond to that. And that's where you see things like many new forms of cybersecurity legislation that you'll see here on the right side. There's not only proposed updates to the security rule, which, to give you some like insight as far as where the security rule is heading, there's already a huge emphasis by the OCR for the need of like risk assessment and risk analysis. But the existing security rule only uses the term risk analysis 2 times. The proposed updates to the security rule use that phrase 129 times. So it's going to be a much bigger emphasis on overall risk analysis. But then, even outside of that, there are currently 3 laws going through Congress and the Senate exclusively focusing on healthcare cybersecurity. Improvement, resiliency, and accountability are the 3 acts that are currently going through Congress and the Senate. Um, these could all have downstream impacts over time. So it's worth mentioning, particularly the change in the security rule, moving away from like what are called addressable requirements into more mandated control sets that need to be implemented. But then you also see huge, expansive enforcement initiatives in areas like fraud, waste, and abuse. You'll see some like 3 massive settlements here. I wanted to get your thoughts, Anne Marie. These are obviously large organizations you see are having these settlements or these issues in areas like fraud, waste, and abuse. How often do you see like organizations like who we have in our webinar having like settlements or issues in this area specifically?
Every day, right? It's
Every
happening
day.
every
Yeah.
day. It's happening at the state level. It's happening in a self-reporting way. It's happening in somebody reported you way. Um, and it's happening, not in this scale, right? This $350 million paid by Walgreens and 202 million paid by Gilead. And then, the lawsuit that HHS just joined regarding Medicare Advantage plans and brokers relationships. These are the big things that are happening, right? But all of the little things they add up. And $100,000 claim to a small organization is more impactful than a $350 million claim at Walgreens.
Yeah, that's true.
And you have to understand that, although the financial impact of the fine itself might not be catastrophic, all of the attention that it draws to your organization in a negative light, the reputational damage it does, and the time and attention it takes away from patient care and building your organization, really, really have a negative impact and follow you for a long time.
Yeah.
Um,
Hmm.
people wanna work for organizations that do the right thing, and when you have a culture of compliance and you don't have, always anonymous reporting and people are willing to come forward, um, and tell you exactly what's happening and show their face while they're doing it, um, you really find that you have a greater sense of stability in your workforce and with your
Mm.
patients. They appreciate that, they don't like to see a lot of turnover.
Yeah, no, that's good. That's good. I think these two areas, at least industry-wise, seem to be, like, the hot button topics right now, so, especially for those looking at, like, what areas to focus on, not only within your organization, but outside of it as well. Then it continues to be even outside of those proposed updates, most HIPAA fines, roughly 80% of them cite missing risk assessment documentation as one of the reasons for the fine. Um, we say here, but like most regulatory risk in that regard can be mitigated with a strong risk assessment strategy. In my mind, because that going through that process is a clear illustration of good faith effort. I mean, what are your thoughts on that statement, Anne Marie? Like as far as regulatory risk being mitigated with risk assessment or
Well,
risk
risk
management?
assessment is the identification of it, right? If you don't do anything after you've identified it, then you're still gonna be in trouble.
Yeah,
But
it's
not
everything
even
that comes
having
after.
taken the step to actually assess it, is really looked upon negatively, um, in any regulatory, enforcement setting. It's
Sure.
really the bare minimum, right?
Yeah. Yep. No, it's the starting point for sure.
Mhm.
Okay. So, folks, at the rest of the session today, we're really going to be going through a step by step process that we hope that you could take back to your organizations and begin implementing immediately. We're going to be going through each of these individually, but the overall framework we're going to be talking through here is identify, assess, address, monitor. And I think even just like having those four terms as a framework for the process for risk management can be helpful in formulating how you're going to approach these things. We've actually already talked about identifying risk already, and I think you gave some good insights on this, Anne Marie, as far as where to focus on. Is there anything else that you would weigh in on this topic as far as like how you identify risk? Like where do you begin looking as far as initial assessment and risk management?
Sure. First of all, obviously your incident reports, right? Where do you have constant things coming in? Where do you have repeatable things happening? Um, what employee feedback are you getting? What informal feedback are you getting? And on top of formal feedback. And then audits, right? If you're a larger organization and even if you're a smaller one, you should be doing internal audit work at least, once a year, if not more often, especially the larger you get, they should be, you know, not only quarterly, but monthly, even weekly, depending on what your needs and, coding stature is. But
Mm,
yeah, I mean, you have to look at what's going on in the organization and look at all sorts of feedback. I saw somebody ask a question about remote environments. Yeah, I mean, you have remote environments, but you should be meeting with those people on occasion, right? In settings where they feel free to speak. Um, they're all of their feedback, you should have a feedback loop, especially from disconnected or, people that aren't in a setting where they can just bump into you in the lunchroom. Um,
mm. Within a remote environment, do you think that like certain like if you have a you're a hybrid workforce or a mostly remote workforce, are there certain topics that are going to be much higher areas of risk? Like how would you think through some of that?
well, obviously cyber risk, obviously, the environment, if they're working in a technical environment and they're only working over a computer, or if they're remote working in the field, it's a little different, right?
Yeah.
We have a lot of remote healthcare workers in the field, and they pose a different type of risk than people that are working in their own homes. So I think, yeah, I mean, and a really good way to do that is maybe surveys or just opportunities to meet in person or opportunities to meet one on one with you. Um,
Yeah.
just schedule random calls with people who are new to the organization or people who have been there for a long time, and just say, it's part of my role to speak to people who've been here and try and find out what their concerns are.
Yeah, makes sense. I know, like, knowing that we've talked a bit about identifying risk, like you have that kind of initial enterprise wide, what are the key areas? You interview employees, you look at the incidents, you look at different enforcement and legislative activity. And then you actually like get to the point where you're completing the assessment. One of the things, one of the first things we talk about here is the concept of likelihood and impact. That's even terminology that we use in our own system. And it's something that I at least get frequent questions about. Could you maybe talk through like that framework of determining likelihood and impact? Like, what do you mean by you have an area of risk? What do you mean by likelihood? What do you mean by impact? And how do you usually use that to then categorize risk?
So for likelihood, it's really it's the probability that it's gonna happen, right? And you can measure it in 2 ways. You can measure it in the likelihood that it'll happen in general, and then the likelihood that it might happen in your setting with the current safeguards and mitigating, things that you might have in place, right? Maybe you have a policy around it and you haven't done training or whatever. And then the other piece of that is the impact, which is really the severity of it, right? Is it gonna be catastrophic? Is it gonna be minimal? And you can't just think of it in terms of finance, right? You have to think of it in terms of reputational risk. You have to think of it in terms of organizational risk, and most importantly, for most healthcare organizations, patient risk.
Yeah. Could you give an example of that in terms of like, let's say one of the HIPAA requirements and how you would think through likelihood and impact, just so that, especially for those who are somewhat new to this.
So think about social engineering, right? Social engineering, phishing, texting, vishing, whatever you wanna there's lots of different pieces of it. But that's usually how a hacker gets in, right? That's how ransomware happens. And if you had a situation where you could not access your records, it would be could be extreme harm to your patients,
Yeah.
obviously extreme harm to your reputation, and it could be catastrophic. It could make you close your doors. So, I think that's a good example. I think it's one everybody understands how important it is to be able to access your medical records of your patients.
Yeah. That makes sense. We had somebody ask actually, so like when referring to risk assessment, are we talking all risks or just security slash cyber? And I mean, I would say absolutely, we're talking all risks here. Cyber security and cyber risk is a piece of what should be your risk management strategy, right? But I mean, how would you weigh in on that?
Sure, cybersecurity is a piece of it, right? You have to do those macro risks, and cybersecurity is going to be one of those macro risks, but it's also going to be one of your micro risks, right? Where you have to actually determine, am I only going to follow the security rule? Am I going to follow something more stringent, like the new NIST CSF 2.0, which is quite honestly what the new proposal for the security rule requirements is based on? So yeah, you have to look at it as a piece of the puzzle, but it is absolutely not the entire puzzle, because honestly, in any organization, people are the highest risk, right?
Yeah.
Their actions, because those are the things that you cannot control with technology.
And then when you're doing that, when you're going through that process and determining the likelihood and impact, is that then what gives you the insight to be able to evaluate and prioritize those areas? So you then are kind of segmenting based on what you determined in that initial analysis?
Sure. I mean, there's many pieces to it, right? Like, and in our system, we have what we call criticality, and then we have a risk ranking. So we have kind of both. So you could have something that's critical to your organization or critical in the industry right now or new to the industry right now. And then you also have the risk rankings. And so you want to, if you have limited resources, which all of us do, you want to be putting your resources towards things that have a great impact if you're able to mitigate that risk, right?
Yeah.
So you use the two together to prioritize your work.
And what about risk tolerance? So I think in general, this is a blocker, I think, for a lot of folks where they engage in the risk assessment process, and there's so many things that maybe need to be addressed. It feels like we can't tolerate any of it, and it feels like overwhelming because they want to address everything. How do you think through risk tolerance and response?
I think risk tolerance is something that you have to get a real feel for, and usually the executive team is, or your directors, are really the harbinger of how your organization sees risk. If they see risk, I can tolerate a high level of risk because I'm gonna have a high level of insurance around it. Great, because then they're only thinking about financial risk, right?
Mm,
It doesn't they're not thinking about risk maybe the way, a compliance officer would, and I think you need to change their thinking if they're only thinking financial.
yeah,
But I think, in the end, people can tolerate risk, but there should be a level of intolerable risk at any organization.
yeah.
Outright fraud, outright
Oh,
billing
sure.
intentionally
Yes.
incorrectly, right? That's not a risk that any organization should be taking, and as a compliance officer, if somebody in the executive team is saying they're willing to take that risk, you have to go above them and let somebody know that's happening, which is a very uncomfortable position to be in, but you have to understand that acceptable risk, is gonna be different in different organizations,
Yeah.
and, um,
Do
I
you have an
think
example from your background of, like, something that was an acceptable risk in an environment you worked in?
something that was an acceptable risk?
Yeah,
Sure, I
like
mean,
something that you decided to
you can have some
tolerate, yeah.
billing errors, right? If they're not intentional and you're doing, spot audits or small audits, 10 claims here or there on an individual, and then you're doing education, and then you're testing again to see if their coding practices or documentation practices have changed. Those are acceptable risk levels, right? I
Yeah,
mean, you're not gonna keep the money when you know that they did it wrong, but you also are gonna I mean, nobody's gonna do it right every single time, right? They're
yeah.
not gonna
It's
document
like it shouldn't be
everything.
happening, but there's no malicious intent,
Exactly.
things
I
like that.
mean,
Okay.
you still can't keep the money, right? But you still it's a risk, that you can address with mitigation, right?
Yeah, very, very helpful. And I think the next thing that we go into here is once you've gone through that process of assessing risks, categorizing them, and then like determining like what you're going to respond to most specifically, I think that gets into like the identify, assess, and now addressing risk. We use the term implement controls here. Could you unpack that a little bit as far as like when you have identified areas of risk? Um, what do we mean when we say, like, implementing controls?
So implementing controls, the 2 things you have listed under there are actually controls, right? Your
Yeah,
policies, your procedures, your standard operating procedures, the training for your employees, retraining employees who aren't doing well at something, making sure that everybody attests to your policies and procedures and knows what they are. Um, those are the kinds of controls, putting an audit team in place or putting, better credentialing practices in place if you have somebody whose license lapsed or whatever it
yeah,
might be. The controls are dependent upon what, um, what you're trying to mitigate, right? It really depends.
yeah,
And you just have to think broadly, and you can think about, like, controls don't have to be, like, giant efforts, right? It can be as much as, okay, my training program isn't doing well. I'm only getting 70% of people doing it on time. Gamify it, right? Give the clinic that did the training first a pizza party. People love to compete with one another. They love to
sure,
have bragging rights. So controls can be as simple as that. They can just be a simple call out in the newsletter thanking somebody for, doing such a great job.
yeah,
Um, They don't have to be giant gestures.
Yeah, it doesn't need to be a huge overhaul of company policy. It could be something simple that you're using to like be proactive.
Exactly.
Yeah,
And then, you know, I guess this comes to the next slide, but monitoring what you've done, right? Was it effective?
yeah,
Did my training levels go up, quarter over quarter, year over year because of the things that I put in place? Um, did I have less issues because people understood what minimum necessary standard was because they actually took the training this year? Whatever it might be.
yeah. That idea of monitoring the effectiveness of the controls that you implement. Um, we sometimes have people that are like, well, I implemented the policy. We had employees attest to the policy, so we're good. How would you think through, like, how do you make sure that that policy is quote unquote effective when it's been implemented? Just as an example.
You have to have a baseline, right? Were they doing this incorrectly before I implemented the training? Are more people doing it correctly now?
Yeah,
Maybe the training wasn't engaging enough, or maybe the training was too long and they lost interest, and everybody doesn't understand the last part of that training because at
yeah,
that point, you know, they were they were on their phones or whatever it is. Um, yeah, you really have to make sure that the things that you're putting in place have created, um, risk mitigation, right? That you
yeah,
have in some way moved a number. In order to do that, you have to have metrics, right? You have to understand where you were and where you are. You can't just say, "Oh, it seems better," right?
yeah. That was one of the key things for me, because I think when it comes to compliance, especially for maybe those who are on the webinar where this is not their main job responsibility, it's sometimes hard to know if the work that they're doing is actually making an impact. I think what you said, as far as almost coming up with what seems to me to be like internal benchmarks, even if it's simple, like we talked about social engineering and phishing scams. If you have a company with a couple of hundred employees and you have 3 reported incidents a month for employees that fell for a phishing scam, or maybe you start running simulations like that and you could see that like X% of the workforce fell for it. Then you implement training, and 3 months later, you could say, we are only having one of these a month, or X, like we drop that down by X%, whatever it is. I think it's really hard to actually know if you're doing a good job if you're not, don't have numbers like that you're going off of. Um,
Yeah, and training is an easy way to say it, right? You can see if people are doing their training timely based on your LMS, or, if they're showing up to the meetings, or however you're doing your training. Usually you'll have metrics around that one. So that's a good one to start with if you don't have metrics elsewhere. But incidents being reported anonymously. That's a really good way to measure whether or not you have a culture of compliance, right? If you're
yeah,
getting a lot of anonymous reports, it means that your culture of compliance, people fear retaliation for making a report.
yeah,
Um, and if you can change that number and you can move that number, it's a really good sign and it's a really good metric to be able to give, especially an outside investigator investigation, that you've made great strides in creating a culture of compliance and that your program is effective.
yeah.
It's a really good way to illustrate it.
I think some of the maybe the smaller companies on here, that can sometimes seem intimidating, where we talk about like you actually want more incident reports. Uh, and I always say to people, it's not the incidents that you hear about that are the biggest concern. It's the ones that you don't, right? It's the ones that you're not hearing about that you can't address in many
Sure, and let me
ways.
clear that up. I wasn't saying that you want more incidents reported. I'm saying if you measure how many of them are reported anonymously versus how many of them are reported by a person willing to show their face.
I see. Yeah, yeah, yeah. Well, I did meet with a compliance officer. It was a couple of months ago, and one of the things that she mentioned to me is that when she joined the company, there were 0 reported incidents happening ever. Like nobody was reporting any incidents. And she said that like she actually saw it to be a very healthy sign that the things that she was doing was working, because she was getting more like 10 to 20 incident reports per month. And that's more what I mean. Like, yeah, like employees actually feel comfortable notifying you of things as
Yeah,
compared
again,
to
that's
not
not
reporting at all.
right. You have to make sure that, the company understands, that the organization understands it's not a failure because you're getting these reports,
Yeah.
right?
Yeah.
It's
Yeah.
a, it gives you actionable information. It also gives you, like, you're gonna get reported incidents, and it's why we call them incidents, right? That are nothing. It's not illegal to do what they were doing, or it's not, even against a policy to do what they were doing. And that gives you an opportunity to then go out and say, but my employees didn't know that. So I need to
Yeah.
do some training in that area to make sure that they understand where the lines are.
Yeah. So it's more about like proactivity as compared to
Mhm.
just ad hoc going after the things that come in.
Exactly, yeah.
Cool. So I think that that gives like a nice overview of just what that process might look like for somebody from identifying, assessing, addressing, and then monitoring. I think it's interesting because in a lot of ways, monitoring to me is even one of the ways that you address risk because it's like they go hand in hand. Like in order to adequately address risk, you have to be keeping track of it over time um, and updating it when it's needed. Uh, we have this slide here which talks about like monitoring changes. Is there anything that you would call out in here as far as like changes in organization, changes in environment? Do you have any examples of like things that you've seen in the past and how you would think through that?
One good example would be implementing a new EHR, right? That is a huge change in an organization, and you have to make sure that your EHR is set up correctly and that perhaps your old EHR had safeguards that aren't available in your new one, or you never had one before. Make sure that you're setting the safeguards up and that you're monitoring, is somebody trying to break the glass too often, whatever it might be.
Yeah,
Uh, so, yeah, I mean, I think technology changes are a big one. Mergers are another one,
sure.
um, where you have a bunch of new people coming in who've had different training and different processes and different policies in place, and trying to find the best of both and bringing them together.
Yeah.
And just even like significant changes in leadership, even. Um,
How does leadership impact things? Why do you call that out specifically?
Well, leadership, I think for anybody who's under investigation or anybody who's ever gone through an accreditation, tone at the top is always one of the most important things. They understand that the compliance officer cares about compliance. They also want to know that the managers in the organization, the clinical managers, the safety managers, the operational and financial managers, that they believe that compliance is part of their role, and it is also their role to um, show that their employees and their staff that they care about it and they have
Yeah.
expectations um, that they will be meeting compliance requirements.
Yeah. Yeah. Makes sense. I think I saw in a recent like DOJ publication that one of the things that they instruct auditors to look at is the C level on the board and at the level of the board and like are they actually supporting the culture of compliance within the
Well, not
organization?
only supporting, but helping make decisions,
Yeah.
like, giving resources where they're needed, assuring that disparate voices are not only um, allowed to be spoken, but are heard,
Makes
right?
sense. Yeah. Make Makes sense. At this point, I think we wanted to talk about some practical applications for how you might think through this process regarding maybe a specific topic. I know that we have a lot of people that use us for HIPAA compliance and a lot of people that come to us thinking about like cybersecurity, privacy needs. Could you maybe give just like a practical walkthrough of how you might, like, let's say I'm coming into a practice and I've identified one of the significant areas that we need to look at is our HIPAA compliance program. Could you maybe talk through this framework in that context a little bit?
Sure. I mean, if you've already identified it, I guess we could say that you've identified it. What
Sure.
you need to do is assess, do I have policies and procedures in place? Are they actually implemented and operationalized, or are they just sitting in a folder somewhere on somebody's computer? Um, if that's the case, let's say you have policies, but you haven't really implemented. You have to address the implementation of them. And then you have to monitor whether or not after they've been operationalized, they're working, right? And you have to address maybe some of those policies and procedures haven't been updated in 15 years. And they need to be, right? They don't
Yeah.
represent any of the new changes or any, um, you know, they don't appropriately address what to do with a business associate or whatever it might be. Um, yeah, I mean, there are lots of tools out there, and we have a lot of tools. We have
Yeah.
policies and procedures. We have programs that help you not only assess, but then continually address and on
Yeah.
different areas of HIPAA compliance. Um, but yeah, I mean, I guess that's a good example of how I would do it.
Makes sense. When you're thinking through, and I'll call this out for our audience as well, is I think one of the most important things to keep in mind with this is that these steps are being documented in some way. Because you can go through, I think, this whole workflow here, and if it's not in a way that you're able to clearly report on it, it's not going to be helpful in the event of an audit. And so thinking through not only like how do I follow these steps, but then making sure that it's documented somewhere, and that we talked about that kind of risk, uh, likelihood, and impact in the building of a risk matrix is what we call it here. Uh, we just highlighted a little bit extra on this slide to point out that like you should be coming away from that process with a very clearly documented, like, here are my high, medium, and low areas of risk. Because if this is all just happening in a meeting or it's happening in your head, it's not going to be practically actionable. And it's certainly not going to be something that helps you in the event of a regulatory audit, let's say. Anything you wanted to like add to that, Emery?
Yeah, I mean, as an attorney, as a former compliance officer, if it's not documented, it didn't happen. You signing an affidavit that said you had a discussion with this person on this date, it's really not the same thing as having dated documentation that that action took place when it took place.
Yeah,
Um, it's just not given the same weight.
super helpful. We actually had somebody ask about resources pertaining to conducting risk assessment and audit templates or a tool for beginners. We'd actually like to take a little bit of time to show how some of this could be done inside of our system, folks. Uh, our platform is built to be an overarching compliance management tool. We have a specific focus on risk and assessment as an add-on inside of our system, but we can also cover areas like workforce compliance across policy, training needs, all of that sort of stuff. I wanted to give a quick little summary here of the process that we just described, how you might do that inside of the platform. One of the first things I'll mention is that we have an entire library of pre-built assessment templates already set up inside of the program. So when you go into our risk assessment tool, you'd actually be able to pick from a list if you're an advanced user on the specific topic or area that you're looking to complete an assessment on, or even be able to upload your own if you're doing these things in a spreadsheet. If you're a very simple use case, you might just do our basic HIPAA risk assessment to begin with. Maybe you're trying to get your arms around that. Um, I wanted to talk through, Anne Marie, like, let's say we have somebody, just as an example, I'm looking at this privacy assessment inside of our platform. Talk me through like what I'm looking at here on this screen and like how you might approach it.
Well, I think there's 2 ways that I approach it. First of all, each of these is, addressing a different piece of HIPAA. This is the privacy piece of HIPAA. It gives you the actual information about the regulations that you're trying to meet. It gives you, if you could just open one up, just double click. It gives you guidance on what it means, details of how you might be able to meet it. It gives you recommended tasks if you're not meeting it. Um, and then additionally, right, we've got the risk and likelihood there. We've got the ability to send it to somebody else if you're not the right person to answer it. And then we have what we call the freshness scale too, which is a review schedule that is set for you but can be adjusted. So if it's something that, let's say you just had an incident involved one piece of HIPAA privacy, you can filter the controls to the piece of HIPAA privacy that was important to that incident, and you can set the freshness um, scale to maybe you want to do it quarterly until you get a handle on whether you've made improvements there. You can also mark that control critical, right? So if you want to follow how well I'm doing with my things that are critical in the privacy area, um, we've already marked things critical that are, things that are happening in a lot of enforcement is going on, or it's just one of the most critical pieces of um, HIPAA privacy requirements. But you can change them if those things aren't critical in your organization. So you
Yeah.
can use all these tools. You don't have to do the entire program, right? You can do pieces of it that are important to you at this time. You can create as many of these programs as you want. You can name this program privacy in reaction to incident 5 or whatever, so that you understand that it's not the entire thing. But yeah, I mean, I think there's lots of different ways that you can use software, including ours, that have been built for um, people like you, right? Whether this is your full-time responsibility or whether it's not, um, I think everyone else in your organization probably has a piece of software that's helping them do their job. In this day and age, you don't want that piece of software for the compliance team to be AI, Chat GPT, right? You want a tool that's purpose
Yeah.
built for someone in your shoes that helps
Yeah.
you put together evidence and attach it to the regulations, and that way be audit ready, should anything ever come happen, and not only be audit ready, but be compliant, right? Advance the effectiveness of the work that you're doing, create efficiencies for yourselves,
Yeah.
in a way that helps you utilize the resources that you have in the best way you can.
No, that's great. And I'll chime in and say, for those of you that are interested in learning more about our product, you'll see a little call to action on the top right of your screen where you have an option to actually schedule a demo. That is just like that's an opportunity for you just to explore the platform, learn a little bit about it for yourself. If you click that link there, you'll actually be able to schedule directly with somebody in our team. I'm happy to jump on some of those calls as well, if you'd like. So if you're interested in learning more, we are also offering special pricing for anybody who is on the webinar today that schedules in the month of June. So if you are interested in learning more and would like to take advantage of that offer, feel free to click that button, schedule with somebody in our team. We would love to chat with you about this. Our platform can be used for anything from risk assessment and risk management with that built-in monitoring piece through Freshness, but it's also used for all workforce compliance needs. Like we talked about phishing training. We have all of that stuff built into the system. HIPAA, fraud, waste, and abuse training, OSHA, full library of template policies, OIG exclusion monitoring. There's a lot that you could use us for. So if you'd like to learn more, schedule through there. I know that we're almost like at the hour here. This was a longer one. So thank you all for sticking with us here. I wanted to quickly just go through a few of the questions that we received. We had somebody ask, let me see. Sorry, I'm seeing some questions about the recording. This webinar is recorded, just so everybody knows. You'll get a recording after the end of the session. Somebody asked, can you recommend resources pertaining? We just addressed that. We would recommend ours, absolutely. Let me see. Sorry, folks, we have a lot of questions. I'm just trying to pick ones that are going to be relevant to everybody. Somebody asked, we've done physical site assessments yearly for quite some time now, and they've been very revealing. We focus on things like clean desk policies, whether file cabinets have appropriate locks, whether there are screen protectors and monitors close to patient care areas, etc. Um, that's not, I mean, I guess it's not a question. It's actually a helpful statement. Thank you for that. Yeah, and all of those types of audits we can run as well. Somebody was asking, Anne-Marie, can you say more about your statement? You can't keep the money. I think you were talking about
I
like a
was talking
billing or a
about
coding
violation of
violation.
truth. So if
Yeah,
you have a coding violation or you have a particular claim that was filed that you don't have documentation to support, and you found it in a probe audit, let's say you did 10 claims for one provider or at one clinic or whatever. If you find that you were paid inappropriate for that because you didn't have appropriate documentation, you have to reverse that claim or pay that money back. Doesn't mean you have to self-report yourself, but you're not allowed to keep that money, especially if it's under a Medicare or Medicaid program.
yeah. Somebody asked, how do we contact Liam and Anne-Marie after the presentation? Our emails are on the screen. If you'd like, you're welcome to shoot us an email. If you have follow-up questions, you can also, if you can email either of us directly. Happy to chat if it's needed. Somebody else, we have time to maybe do like 2 more questions here, folks. I apologize. Somebody asked, what if you are the person with the most seniority, but the company is growing so fast, there's no one with proprietary knowledge as you take on new risks? How would you look at that, Emery?
Well, if you're the most senior person, you're probably one of the leaders of the organization. You probably know the industry very well. There are also places like HCCA, or other organizations like SEEI, if you're in an international setting, where you can get resources and you can see what kind of webinars they're running, what kind of things are they focusing on right now, and looking to see whether or not you have those risks in your own organization. Or, you might need outside help. If you're growing so fast that you can't keep up with all of the risks or even identifying those risks, you might need outside help for a little bit, um, to help you figure out what those risks are so that you're not, starting an organization in a position where you can't sustain growth.
Great insight. Thank you. One more question here. Can you speak more about operationalizing procedures? Maybe somebody's just looking for you to unpack that a little bit more.
Sure. I mean, what I mean by that is, you can put all sorts of policies and procedures in place, standard operating procedures. They can all be right there on a piece of paper in a binder that you can show your accreditation organization and you can show an auditor or an investigation. But if nobody's following them or nobody knows what they mean, they don't mean anything, right? If they don't know how to follow that requirement, um, you're not you're not in an implemented phase, right? You've adopted a policy or a procedure, but you haven't implemented it or operationalized it in a meaningful way. And therefore, in terms of it acting as a safeguard and mitigating the risk that it was meant to mitigate, it's not going to be successful, right?
Yeah.
Um, so you have to get manager buy-in. You have to get expectations set. You might even put put it in a maybe it's a KPI for a certain amount of time until people understand how important it is. Um, but yeah, that's what I mean by operationalizing. You have to get buy-in, right? You are the compliance officer. You are not the only person responsible for compliance in an organization. And if you are, then you'll never succeed,
Yeah.
because it's really everybody's responsibility.
Yeah. I have said like like what you have on paper should match what is actually happening in practice.
Right.
And if that's not the case, it's not being operationalized because it's not happening. It's just a piece of paper
Exactly.
then, right?
Right.
Um, Anne-Marie, thank you so much for doing this with us. I'm normally like the lone wolf over here in webinar land.
Well,
So
thanks for having me. I mean, it's always nice to speak to an audience that geeks out on things like I like too.
yeah, yeah, no, it's great. Um, Everybody, again, we so appreciate you joining the session today. We went a little longer than we normally do. Again, if you'd like to learn more, feel free to schedule some time with our team. If you have feedback for us on the webinar content, there will be a survey that is sent out after the session ends. Please give us feedback. We would love to just hear from you on how we can make these better and improve them going forward in the future. You can email us as well directly if you have any feedback you'd like to give. So thank you all so much. We appreciate your time today. We'll be ending the session here now. Cheers, everybody.
Bye, everyone.